So I'd like to start by welcoming everyone to this Lunch and Learn. Today we are joined by Rachel Douglas and Abbie Dowse, who are going to be talking to us about supporting personalised maternity and neonatal care in the North East and North Cumbria. And if we could just move on to the next slide, thanks. Just to give you a little overview, these Lunch and Learn sessions are a space for health and care staff to come together to share any experiences, to, of course, learn something new relating to health and care, with a focus on a quality improvement of some description, and of course, to be signposted to any further resources that you would find useful or would like to share with your wider networks. And the next slide, just a few protocols about the session today. We would ask you to keep your webcams off unless you are invited to speak at the end. And of course, likewise, make sure that you're on mute when you're not speaking. You can use the chat functions for any questions or just any comments as well. We will hopefully have time for a few questions at the end, so we'll refer to the chat box. But at the end also, if you would like to ask questions, if there is time, you can pop your hand up and take yourself off mute and put your camera on to interact with our presenters. Please listen with respect and obviously be present and teach this forward. You can share this with your wider networks as well. We are recording the session, so the recording will be available after the event on the Boost YouTube channel. And again, you can watch after the event or you can share it with anybody that you think would be interested or would benefit from listening to our presentation today. And so without further ado, I'll pass you over to Rachel, who will start the presentation.
Hi everyone, and thanks so much for joining today. We're going to take you through the North East and North Cumbria local maternity and neonatal system personalised care toolkit, and that's what we've been working on over the last year. So we just thought we'd take you through a little bit of the process that we went through and what we've developed, and hopefully that those resources we can share with you to use within your organisations, within your trusts, or really just within different areas of the system. So just to give you a little bit of an overview, in many different, we received personalised care guidance. There was the Ockenden report, the long-term plan, the 3-year delivery plan for maternity and neonatal services, and personalised care shone throughout all of that. And as part of the work within the local maternity and neonatal system, we decided to set up a personalised care task and finish group. That was also on the back of some communications that we received from maternity and neonatal voice partnerships. So that is service users within the system. And also we had those requirements that we needed to fulfill as part of that delivery plan for maternity and neonatal services. So what we've done first of all is we held a choice and control workshop, and that was in March last year. And that really helped us shape the personalised care work plan and how we would develop this. In the run-up to that, we also had many different engagement sessions, which was engagements with service users, but also with staff from various different specialties working in maternity and neonatal services. And then we developed the Personalised Care Toolkit. And that was really with a commitment to improve equity for mothers and babies and meet the needs of our local population, which is why some of the resources have been translated into the top 5 languages, many in the top 15 languages, and also in easy read. So just to talk to you a little bit about the Choice and Control workshop, this was an independently hosted workshop, and it was really focused around what needs to happen when a woman and clinician interact for personalised care to be achieved. It brought together multiple stakeholders, so we had 9 tables of 8 people, and there was a really good representation from service users and clinicians from across the North East and North Cumbria geography. We did offer a token of appreciation and maximise attendance from the likes of service users, doulas and independent practitioners. And as part of that, we did offer a £50 Love to Shop voucher. And on the day, we looked at what NHS England suggests is personalised care. So we looked at that definition, that that comes from NHS England around personalised care. And the report that came back from our event was really there's not a shared understanding of personalised care in within maternity and neonatal services in North East and North Cumbria. The lack of shared understanding exists between women and clinicians, and between clinicians. It manifests in many different ways and creates disharmony and a gap in expectation between what women want and what clinicians are able to provide. So we work together to define some principles, and this is the first part of the toolkit. So we worked with women, families, midwives and doctors, and we created these 4 principles. These principles are really part of a tool, and they can help to make choices about the care. It's really there to kind of support those conversations and help between a service user and midwife or doctor to have those open and honest conversations and talk openly about choices. So our LMNS board and our personalised care group accepted these principles, and we really started to use that as a measure, so we could start to measure the impact from a service user perspective around how many women are truly receiving personalised care within the definition that would agreed. So it started as the principles document, but we realised there was more that we needed to do to kind of develop the toolkit. So this just gives you a little bit of a summary of what the Personalised Care Toolkit and what is included as part of that toolkit, sorry. So as I've said throughout all of this, it's been co-produced, and it has been a joint effort with our service users, with our clinical leads, with staff working in the system. And I really do think that is a key element of what made this project such a success. Throughout the toolkit, we've developed videos. So there's videos across each NHS area, and that showcases their local birth options. There's tools within that can support open and informed conversations and help you have more open and comfortable conversations with families and healthcare professionals. There's lots of leaflets, posters and QR codes that can be printed out and shared across various different parts of the trust. And also Abbie's here to talk a little bit about the comms that went into this, and also how some of the comms toolkit can support you in your areas of work. Just lastly, really touching on the small working groups, personalised care felt like such a mammoth piece of work, and it was how do we break that down into meaningful chunks to really get the best out of what we were trying to achieve. So some of the key areas that we focused on, and this was raised at the Choice and Control workshop, as areas of challenge, were induction of labour, place of birth, vaginal examination, informed consent. So what we've done as part of that is we commissioned perinatal place of birth films, and that was at all locations. You will realise that Berwick doesn't appear on there, and also South Tyneside, and that was really just because of planned refurbishment and ongoing discussions with the trust. The place of birth films are really supported with a shared decision making tool, and that gives people information about where you can choose to give birth. As well as that, we've done an induction of labour guideline. That's for the system, so that women are receiving the same information regardless of which trust you go to. And in terms of vaginal examination and informed consent, there was a literature study conducted by one of our team members, and also some posters and conversation tools developed on the back of that. But just to say that all of the information is standardized across the 8 trusts. So like I said, everybody's receiving that same information. We have translated the videos into the top 5 languages. So each trust has their own film in their own top 5 languages, but the documentation has been translated into the top 5 North East and North Cumbria languages. And we do have some badger notes information that is available in the top 15 languages. We also supported ICB Health Literacy supported us, so all of the documentation was reviewed by Health Literacy, and also worked with the Learning Disability Network across the ICB to translate some of the information into easy read. We also looked at badger notes, so you can record your pregnancy choices in a Badger Notes app, and Badger Notes is an electronic maternity record. It's used across all 8 of our trusts, and you can, like I say, record your various choices. So what we found is that we needed to develop some information around, firstly, how you can access Badger Notes to record your personalised wishes and choice, and also how you can download the app. So within that, we created a comprehensive document, and I think it is quite comprehensive. There's a lot of information in there, but it's really to help people download the app, navigate to where they need to record that, so clinicians are able to review that before their appointment. There's some posters that were developed that can be put throughout the unit, just to encourage service users to download the app. And also we're working on a video which should be up very soon, and that is a standardised video across North East and North Cumbria about how to use Badger Notes effectively. All of the personalised care information has been included in part of the North East and North Cumbria training syllabus. So we've worked with the different universities to ensure that training is offered to midwives and students coming through the system, so that they're aware of this before they join the trust. And I'm just going to hand over to Ray. Is Ray here now? I just can't see the chat. And Ray is one of the service users who were involved in the project, and she's going to give a little bit of an overview on the feedback we've had so far. Three, yeah, not yet. Shall we jump to Abbie first? We'll move. I'll just move along. Abbie Dowse is here, and Abbie's just going to give a little bit of an overview from a comms perspective and how we've worked together with Health Innovation North East around the toolkit. So Abbie, I'll just hand over to you now. Thank you.
Thanks, Rachel. So yeah, like Rachel said, I'm Abbie Dowse. I'm part of the comms team at Health Innovation North East North Cumbria, and have been supporting the LMNS with the Personalised Care Toolkit and the comms on that. So just to kind of get started, I thought I'd go through some of the key messages that we've kind of weaved throughout all the comms and the toolkit as well. So the first one really is just that everyone has the right to personalised care. So we did really want to make that clear throughout the toolkit that it's not just for low risk pregnancies, it is for everyone. And even if you've got a more complicated pregnancy, everyone should have a choice in their care. And then just talking about some of the benefits as well. If you're more involved in your care, you're much more likely to be engaged and have a better experience if you feel like you're making decisions about your care and your baby. And then just the toolkit is for staff as much as it is for service users as well. So a lot of the messaging was towards staff as well. So we did want everyone to be included in the toolkit. And then just with personalised care, I think when we first started this, it's quite a woolly topic. And like Rachel said at the start, there was a lack of shared understanding between everyone about what it meant. So really just going back to the co-produced principles to underpin everything, and an open and honest conversation can really make all the difference. So if you're unsure of where to start, just going back to that could make all the difference to making care personalised. Next slide, Rachel. So just what we're doing to make the toolkit accessible. So Rachel's touched on some of this as well, but obviously we try to make everything health literate. So working with the ICB health literacy team, a mix of content, so print, digital, video content written. So we know not everyone is digitally access. So just making sure we've got printed versions as well. And obviously that mix of all different types. It was very much co-produced with the MNVPs and service users, so really making sure that what they wanted was what was included. So we did want to make this right for everyone, and really taking on their feedback when they did tell us what they wanted included. The social messages were very much reviewed by service users as well. So we did a myth busting campaign just to kind of break down some of those barriers and kind of explain what personalised care means. So that was reviewed by service users to make sure they were happy and they were seeing the messages that they wanted in there. The videos, like Rachel said, have been translated into the top 5 languages per trust. And then we're working on to getting all the leaflets translated into the top 5 languages for North East and North Cumbria. And then just sharing after, so obviously I've just gone back to my top point, just sharing with underserved groups via community groups and the voluntary sector as well, to make sure that kind of reaches everyone as much as possible. Next slide. So just where did we share it? So obviously all the traditional kind of ways. So we shared it through the LMNS social media, through the website. We had press release news stories, worked with the ICB to put it out through their comms. And we did have a comms toolkit as well as the personalised care toolkit. So that included kind of ready-made content that could be shared for MNVPs, to go to GPs, ICB bulletin, women's centres, that could be shared with charities in the voluntary sector, and just working with the trust comms teams as well to make sure that it was available for all staff and they knew that it was there. And then again, sharing on Badgernet. Next slide. I think that was everything from me. So I think just passing on to Ray, if she's here.
It doesn't look like Ray's joined just yet, but I can just cover the next couple, and then if Ray's not back up, we've got some slides that I can share on Ray's behalf. So the next was really just from Elaine Gauss here. Elaine is our clinical lead for the obstetric clinical lead for the project, and Elaine's been involved throughout the development of the project. So just to see if anybody has any questions or what that looks like in obstetric world, then Elaine will be available at the end just to take any questions from yourselves. In terms of what we're doing next, so we did launch the Personalised Care Toolkit in May, and that was with the fully supported comms package for service users and staff, and that is really to support us from a service user perspective. So we're further developing the resources to work with the training faculty and embed these into all North East North Cumbria training syllabuses for 25-26. We're also working with BI data and analytical colleagues to monitor and measure the impact of the toolkit. So we do have a small task and finish group running at the moment, and that's really to look at certain measures of the CQC survey and how we can triangulate the impact of the toolkit with some of the other data measures that we collect in the system, as well as producing regular data reports, so we can keep an eye on this. We've also commissioned an evaluation that will take place in May 2026, so that'll be a full evaluation around the impact of the toolkit, and we're continuing to work with NHS England around some of the informed consent and vaginal examination work. Just before I start on Ray's, I'm just going to double check Ray can't make, I don't think Ray's here yet. So what I'll do is I'll just present Ray's slides on her behalf. And Ray presented these slides at the Personalised Care Task and Finish group just last month. They'd done a little bit of a review with service users about the impact and that the feedback that the Personalised Care Toolkit has had so far. So we're 3 months in. The direct feedback has generally been really positive. This is just some of the quotes, and I can go through them, but I don't know if you just want to take a few minutes just to read some of the feedback. There is some information there about wishing that it extended past North East and North Cumbria, but I think one thing to see is that the tools are very generic. So yes, they're developed for maternity and neonatal services, but they absolutely could be used in any parts of the system. Yeah, and just the importance of personalised care. So we've had generally quite a lot of positive feedback from the service users. They really like the toolkit and keen to use it and share it with families across their area. Ray highlighted just some of the successes that they, as a service user, felt from the project. So they really like the collaborative approach. You know, they felt involved and that service users were at the centre, and it was a joint effort. And I do think that again, I know I just said that a little bit earlier, but I do think that was one of the main successes of the project. Was there was a real joint effort from the system and various different service users, but as well as staff working across the system who were really invested in developing the tools. There's positive examples of embedded personalised care being given to our MNVPs. So we've got 10 MNVP leads in each area across North East and North Cumbria, and they've got many examples, which I'm sure Ray could share if anybody wanted to see those. This is just a little bit about the acknowledgement that it is early days. It's only 3 months in, and what they hope for going forward. So continue to embed this for consistency, making sure it's used in practice and it becomes normalised. And obviously we're working with the universities and the trusts to make sure this does become practice. And I think many of the trusts have really taken this on board. So you may have seen specific trusts having like a personalised care awareness month where they're sharing some of this documentation and really encouraging service users through their social media, TikTok, Twitter and things like that, to make them aware that these information and resources are available to them. They just said it's really important that doctors are involved and implement the toolkit, and it's not just midwives. Again, that goes across the system. So there was lots of involvement from obstetricians, doulas, service users. There was also links with mental health, community support workers, and various different organisations from the charity sector too. We don't hear how it has helped consultation appointments from perspective of individual service users, and we have yet to hear. So I'm hoping that the evaluation can support them to do that, and just recognising that personalised care, choice and control is for everybody. All service users can be vulnerable on the maternity and neonatal journey and need individualized, respectful care, and needs to be responsive to the feedback and themes from the birth reflections, pals and complaints. And absolutely that shines throughout the whole of the personalised care work stream. So I hope I've done Ray's slides justice, but that's just a little bit of a whistle-stop tour, I think, of where we're at with the toolkit at the moment, how we've developed it and how it's working in practice. And I really do hope that's been useful to everybody. And thanks again for joining the call today.
Thanks very much, Rachel and Abbie. That's brilliant. And I think it's probably really spotlighting the importance of co-production and involving service users in any resources that involves their health and care and well-being. I love the fact that you've had lots of input from the health literacy team as well, and the fact that there is in different languages, there is different platforms to access the resource too. And of course, like you pointed out, it's no doubt something that can be very translatable into other services or departments as well. Does anyone have any questions? There's nothing in the chat right now, but if you have any questions, feel free to put your hand up, take yourself off mute, pop your camera on. Yeah, Lucinda, go ahead.
Hi, I was just reflecting on some of the feedback points, and I suppose there's maybe like an element of irony in the personalised toolkit not being so personalised down to area and what information they can find that is local to them. Is there any scope for any further work on those kind of things, or signposting for users to be able to get information that is for their area as part of this work?
Yeah, absolutely. So we worked across the North East and North Cumbria ICB, and obviously work with the 8 trusts within our ICB. But what we have heard, particularly from North Yorkshire and some of the other LMNSs across the actually nationally, they're really interested in adopting this toolkit and developing it for their specific areas. So that's definitely a work in progress. I don't have specifics around where they're at with that, but we've definitely linked with our 4 closest LMNSs who are all looking to do something similar. But in terms of the North East and North Cumbria local maternity system, we're very happy to support that, but we wouldn't be extending that out wider.
I think to answer the question further, it's about the information that's been done at system level. It has a lot of generic and shared processes included, but then it also does have mention of specific links to get information for that unit if you're booking for something at a specific unit. I think that's what you were perhaps asking.
I suppose it's just thinking of all of the different local services. I mean, I work for a third sector, so I'm not within the NHS. I work with Happy Mums and we provide peer support groups, but we're just across North and West Cumbria, so we don't reach across to the Northeast. But some of the feedback that we've had from some of our mums recently is just wishing there was that kind of one place to find the information of the different things that they can go to. And it feels like this toolkit, I get that this toolkit is about I feel like this toolkit is about empowering them to make the decisions that is for them. But it feels like there could be a really a nice segue into this is what is also available for you. And I suppose one of the things that we're getting asked at the minute is things around antenatal classes and whether they exist or they don't exist and where can they find out about them, and we don't have that information either. So I suppose I'm kind of tying a lots of things in together as to where could be a hub of all knowledgeful things, which isn't necessarily this, but could it be?
So I think a lot of the information is restored on the website, which isn't working at the moment. So that's rather unfortunate. And that can be a link, but I take your point about actually having this that then offers more further information. But it's the start, isn't it? It's the start of something that hopefully and we do have to wait for the full evaluation to enabled knowledge of impact, but I think it's something that will probably further develop as we move forward, but we'll have to wait and see.
Okay, thank you.
I would say as well, just the videos that we did with each trust, they're definitely obviously services specific to each hospital, so they're probably a good starting point. But yeah, like Elaine says, I think it was definitely at a starting point, and we can definitely build on it with more. And we're working on a template at the minute as well, which trusts can use to fill in their details just with kind of generic high-level information about the hospital if people are transferring between units and have maybe gone to a different place where they've never been before. So that's something we're working on at the minute, but yeah, definitely more to be added if we're good.
Specifically, we have been contacted around mental health and bereavement services about what work we could be doing and adding that to the toolkit. So again, it's definitely something that we're thinking about. It's just not sure, given the current picture across the ICB, exactly what we'll be able to achieve. So I think it's, yeah.
Yeah, I mean, I get that there's always time and budget restraints and you've got to do what you can do. You can't do everything all in one go. Talking about the mental health, it would be, is there information in the toolkit around what happens if you end up in a mum and baby unit, or what a mum and baby unit looks like, or anything like that?
We're working with Jan Rigby across the system and the provider collaborative, because they're looking at something that could be added on to the toolkit, but there's no specific information in there at the moment around mum and baby units.
Okay, thank you.
Okay, thanks very much for that. It sounds like this amazing work that you've all already had lots of input in is not finished. And of course, as you've pointed out already, the evaluation report might start to springboard some further developments as well. So Amy has just posted in the chat that sadly there is a national outage of platform that hosts or supports a lot of websites, one being the LMS website. So I'm afraid the link is in the chat. It is the correct URL. So you can look back and just keep checking on that to find some more further information. And of course, have a look at what the toolkit looks like itself. Does anyone have any more questions? There isn't anything in the chat right now. But if anyone wants to pop their hand up, we do have a minute left if anyone wants to ask a quick question. Okay, so because you've been attending this session, you will get an email asking for some feedback. It is just a couple of minutes of your time, and all feedback is obviously gratefully received. And on the final slide, if you have any ideas or suggestions for further lunch and learns in the future, there is an email address on there, the info@boost.org. Feel free to get in touch to suggest a topic or a project that you think would be ideal for one of these improvement sessions. The next lunch and learn that we have is on the 9th of December, and it's about the Newcastle Community Health Bus. There is a link in the chat right now where you can book your place, and that will be at the same time from 1 till 1:30. And look out for more sessions in the new year on the Learning Academy Boost platform. So we'll wrap up for today. Thanks again to our speakers, and thank you to you all for attending and listening, and do get back in touch and reach out if you want any further information. Thank you very much. Goodbye.
Thanks, everyone. Bye.